One of the many ways you protect and promote the health of children when they're in your care is to assess their current health status. This information will help you determine the actions you'll need to take to work with families to keep children healthy. Health status information you'll need includes immunization records, lead screening results, the existence of a special condition such as an allergy, and a health provider's signature attesting to the current health status of each child based on a physical examination. All of this information can be found on the OCFS Child in Care Medical Statement. Let's take a closer look at what information this form can provide and then determine what you need to do with this information. The Child in Care Medical Statement will help you understand the child's current health status. It's a good way to help families understand that young children need ongoing preventive health care. Completion of a TB test is not required for entry into care. The need for this test is determined by the child's health care provider. Lead screening is not required. However, because lead poisoning is a severe risk to a child's long-term well-being, programs are required to supply families who've not had their child screened with information on lead poisoning and refer them to a healthcare provider or local health department. The summary of physical exam section does not have to be completed. All that is required is that the box is checked and the healthcare provider's signature is on the form. Forms can only be signed by a physician, physician assistant, or nurse practitioner licensed to practice in New York State. Forms signed by registered nurses or other healthcare practitioners are not acceptable. Be sure to check for special health conditions. Information provided must be sufficient so you know what you need to do to safely care for the child. Additional documentation detailing the child's needs may be necessary. You'll want to ask families to update the information regularly. For children under 2, quarterly reminders are recommended. For older children, annual updates should be completed. If a child with special needs is enrolled in the program, you must work with the parent or guardian and the child's healthcare provider to develop an individual healthcare plan for a child with special healthcare needs. This healthcare plan must include any special training that program staff may need to meet the child's needs.